We formulated two separate clinical questions, one on specialist palliative care and one on general palliative care, as we thought that it was important to consider also a general palliative care approach, which has been implemented, for example, in a clinical trial which was conducted in Italy, the Pensame RCT. We produced 36 recommendations. Unfortunately, only one of these recommendations was a strong recommendation, and it was on nabiximols to treat spasticity, which is a common symptom in this population. And we produced also 7 good clinical practice points or statements. And on palliative care, we produced one recommendation which focused on home-based palliative care interventions, being either general palliative care interventions or specialist palliative care interventions, and also one good practice statement regarding hospital or outpatient palliative care interventions. So, because on this topic, we didn't find any evidence in this patient population. In the care of people with progressive MS, which, as I said, integrates neurology, palliative medicine and rehabilitation, because usually palliative care is considered by people and also by clinicians sometimes as something that is implemented at the end of life, which is not correct. So it is important that an integrated approach is started quite early. And these palliative care interventions can go together with other interventions, for example, disease-modifying approaches in a simultaneous way of, in a simultaneous approach. And then specialist palliative care can be implemented when it is necessary, but in a more coordinated and continuous care, so that people are not referred to another specialist, but they receive their care in a more holistic and integrated way. I think that this message is quite important for people with progressive neurologic conditions, and specifically for people with MS. Almost half of our recommendations were on symptom management, because there are several symptoms and often a combination of symptoms that are present in this patient population. As I said before, one strong recommendation, which was the only strong recommendation, regarded the use of nabiximols in people with progressive MS having spasticity. For the other symptoms, we didn't find so much evidence, particularly because for symptoms which are common in this population, such as fatigue, anxiety, depression, or bowel on bladder symptoms, we did find studies, but most of the evidence was from people with in the earlier phases of the disease. Anyway, we decided that even if we didn't find so much evidence for such symptoms, we produced anyway good clinical practice statements in this case. I would also like to emphasize that going back to our guideline, of our clinical questions regarded advanced care planning, which is an important aspect of palliative care and in general of care for patients with progressive disorders. we didn't find evidence specific for people with severe MS, but from this guideline, some studies were planned, and in Italy we are, for example, conducting a phase 2 trial on an advanced care planning intervention for people with MS, and we hope that in the next EAN conference there will be the opportunity to share the results of this study.